ऊर्जा पयसा पिन्वमाना सामा मेधा सुप्रतीकाजुषन्ताम् मयि मेधां मयि प्रजां मयि अग्निस्तेजो दधातु मयि मेधां मयि प्रजां मयीन्द्र इन्द्रियं दधातु मयि मेधां मयि प्रजां मयि सूर्यो भ्राजो दधातु। ओम शांति शांति शांति। नमस्कार।
Thank you, Gajanana Bhatt. He is our Veda student and he is a chartered accountant, able to make our prayer talking about the Medha Devi.
ನಮ್ಮಮ್ಮ ಶಾರದೆ ಉಮಾ ಮಹೇಶ್ವರಿ ನಿಮ್ಮೊಳಗಿ ಹನ್ಯಾರಮ್ಮ ಕಮ್ಮ ಗೋದನ ವೈರಿ ಸುತನಾದ ಸುಂಡಿಲ ಕಮ್ಮ ಗೋದನ ವೈರಿ ಸುತನಾದ ಸುಂಡಿಲ ಹೆಮ್ಮಯ್ಯ ಗಣನಾಥನೇ ಅಮ್ಮಯ್ಯ ನಮ್ಮಮ್ಮ ಶಾರದೆ ಉಮಾ ಮಹೇಶ್ವರಿ ನಿಮ್ಮೊಳಗಿ ಹನ್ಯಾರಮ್ಮ ಹುಟ್ಟದಟ್ಟಿಯು ಪಿಡಿದುಟ್ಟ ಚಲ್ಲಣಗ ದಿಟ್ಟದಾನಿ ವನ್ಯಾರಮ್ಮ ಹುಟ್ಟದಟ್ಟಿಯು ಪಿಡಿದುಟ್ಟ ಚಲ್ಲಣಗ ದಿಟ್ಟದಾನಿ ವನ್ಯಾರಮ್ಮ ಪಟ್ಟದ ರಾಣಿ ಪಾರ್ವತಿಯ ಕುಮಾರನು ಪಟ್ಟದ ರಾಣಿ ಪಾರ್ವತಿಯ ಕುಮಾರನು ಹೊಟ್ಟೆಯ ಗಣನಾಥನೇ ಅಮ್ಮಯ್ಯ ನಮ್ಮಮ್ಮ ಶಾರದೆ ಉಮಾ ಮಹೇಶ್ವರಿ ನಿಮ್ಮೊಳಗಿ ಹನ್ಯಾರಮ್ಮ ಮೋರೆ ಕಪ್ಪಿನ ಭಾವ ಮೊರದಗಲದ ಕಿವಿ ಕೋರೆದಾಡೆಯನ್ಯಾರಮ್ಮ ಮೋರೆ ಕಪ್ಪಿನ ಭಾವ ಮೊರದಗಲದ ಕಿವಿ ಕೋರೆದಾಡೆಯನ್ಯಾರಮ್ಮ ಮೂರು ಕಣ್ಣನ ಸೂತ ಮುರಿದೇಟ ಚಂದ್ರನ ಮೂರು ಕಣ್ಣನ ಸೂತ ಮುರಿದೇಟ ಚಂದ್ರನ ಧೀರದ ಗಣನಾಥನೇ ಅಮ್ಮಯ್ಯ ನಮ್ಮಮ್ಮ ಶಾರದೆ ಉಮಾ ಮಹೇಶ್ವರಿ ನಿಮ್ಮೊಳಗಿ ಹನ್ಯಾರಮ್ಮ ರಾಶಿ ವಿದ್ಯೆಯ ಬಲ್ಲ ರಮಣಿ ಹಂಬಲನುಲ್ಲ ಭಾಷಿಗದಿ ವನ್ಯಾರಮ್ಮ ರಾಶಿ ವಿದ್ಯೆಯ ಬಲ್ಲ ರಮಣಿ ಹಂಬಲನುಲ್ಲ ಭಾಷಿಗದಿ ವನ್ಯಾರಮ್ಮ ಲೇಸಾಗಿ ಜನರ ಸಲಹುವಗಾಗಿ ನೆಲೆಯಾದಿ ಲೇಸಾಗಿ ಜನರ ಸಲಹುವಗಾಗಿ ನೆಲೆಯಾದಿ ಕೇಶವದಾಸ ಕಣಿ ಅಮ್ಮಯ್ಯ ನಮ್ಮಮ್ಮ ಶಾರದೆ ಉಮಾ ನಿಮ್ಮೊಡಗಿಹನ್ಯಾರಮ್ಮ ನಿಮ್ಮೊಡಗಿಹನ್ಯಾರಮ್ಮ ಆ, ಆ,
So thank you very much, Sanviti from California, singing this prayer song on Devi. Next we have a Suktam, Stotram from Shiv, from Uday Ravi.
नमः हरिः ओम गुरुब्रह्मा गुरुर्विष्णुः गुरुर्देवो महेश्वरः गुरु
Yes, some audio problem now.
भूषणं भारती पदमारूढं भारती तीर्थमाश्रये विद्याविनयसम्पन्नं वीतरागं विवेकिनां वन्दे वेदान्ततत्त्वज्ञं विदुषेखरभारते शङ्करं शङ्कराचार्यं केशवं बादरायणं सूत्रभाष्यपरं वन्दे भगवन्तौ पुनः पुनः ऋतुस्मृतिपुराणानामालयं करुणालयं नमामि भगवत्पादं शङ्करं लोकशङ्करम् अथ शिवमानसस्तोत्रः रत्नैः कल्पितमासनं हिमजलैः स्नानं च दिव्याम्बरं नानारत्नविभूषितं मृगमदामोदाङ्कितं चन्दनं जातिचम्पकबिल्वपत्ररचितं पुष्पं च धूपं तथा दीपं देवदयानिधे पुष्पते हृत्कल्पितं गृह्यतां सौवर्णेन रत्नखण्डरचिते पात्रे घृतं पायसं भक्ष्यं पञ्चविधं पयोधयुतं रम्भाफलं पानकं शाकानामयुतं जलं रुचिकरं कर्पूरखण्डोज्ज्वलं ताम्बूलं मनसा मया विरचितं भक्त्या प्रभो स्वीकरो छत्रं चाम्रयोर्युगं विजनकं च दर्शकं निर्मलं वीणाभेरीं मृदङ्गकाहलकला गीतं च नृत्यं तथा साष्टाङ्गं प्रणतिस्तुतिर्भोविधा एतत् समस्तं मया सङ्कल्पेन समर्पितं तव विभो पूजां गृहाण प्रभो आत्मा त्वं गिरिजामतिस्साचराः प्राणाः शरीरं गृहं पूजा ते विषयोपभोगरचना निद्रा समाधिस्थितिः सञ्चारः पतयोः प्रदक्षिणविधिस्तोत्राणि सर्वागिरो यद्यत् कर्म करोमि तद्दखिलं शम्भो तवाराधनं करचरणं कृतं वा कायजं कर्मजं वा श्रवणनयनजं वा मानसं वापराधं विहितमविहितं वा सर्वमेतत् क्षमस्व जय जय करुणाब्धे श्री महादेव शंभो शांति 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 श्रीकृष्णार्पणमस्तु।
So thank you, Uday Ravi from India, a student of Adhyayana Kendra.
నమస్కారం, నా పేరు శ్రద్ధ. ఇప్పుడు నేను పరిపాలన ఒక పాట పాడతాను. రాగం రీతి గౌళ, తాళం రూపక. రాసిన ఆయన శ్రీ త్యాగరాజ స్వామి. పరిపాలయ 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 రఘునాథ పరిపాలయ 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 రఘునాథ కనువేని కనువైన సదనము परिपालय 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 रघुनाथ इभपालकाभिमानमु शुभचेलमु रघुनाथ परिपालय 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 रघुनाथ घनकीर्तिनि मल्कवासन कंदमुरा रघुनाथ परिपालय 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 रघुनाथ हरिनाम स्मरणं भुलु विरुलौरा रघुनाथ परिपालय 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 रघुनाथ तोली दुष्कृत फलमेल्ल उगुल धूपमु रघुनाथ परिपालय 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 रघुनाथ नी पद भक्ति पोदुनु दीपं बगु रघुनाथ परिपालय 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 रघुनाथ नीनु जूचुटे घनदीप राधनवूर रघुनाथ परिपालय 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 रघुनाथ पूजा विधि नैज त्याग राजकृतं रघुनाथ परिपालय 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 रघुनाथ परिपालय 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 रघुनाथ परिपालय 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 रघुनाथ
ಗುರುಗಳೇ ಮ್ಯೂಟ್ ಆಗಿದ್ದೀರಾ?
So we have this beautiful rendering of Sangeetanjali by Sanveeti from California. Next we have Shraddha from Indianapolis. So you observe that they are learning music and other things, though they are outside India. Congratulations to these children. Thank you very much. Now Prasad.
Yeah, good morning. Thank you all for joining. So we have our program today, which is the Pravachana Malika by Dr. Madhu Gundlapalli. So I will share the program flyer. So we've had the Veda Kusumanjali, and then we had the Sangeetanjali and Shloka chanting by Uday Ravi. So today we're happy to introduce Dr. Madhu Gundlapalli, who's talking for the first time in our forum, and her talk will be on dispelling myths and misconceptions about psychiatry. So we're very happy, and Dr. Madhu Gundlapalli is a senior psychiatrist working in the public health system at Atlanta. and she will give us the keynote talk today. And I'd like to have my father, Dr. Prabhakar, please introduce her.
So welcome to everybody, and today we have a very auspicious day. In India, people are celebrating the Akshaya Tritiya, where Mahalakshmi is also worshipped too much, and people become glorious and prosperous because of the grace of Mahalakshmi. Here we have also another Mahalakshmi to bless us with the knowledge of the psychiatry, which is a very important thing. We always talk about the body, because philosophically, body, mind, and spirit. So my body doctors are there. There are medical doctors and all that, plenty of them. And again, mind also an important factor, because I just said Vak and mind, they are related. If your mind is pure, educated, cultured, trimmed, and all conditions are okay, then your speech also will be good and appreciated. So that kind of wonderful. And moreover, this psychiatry is an interesting subject under medicine, and it has got a specialization also, and it has got to scope for study, diagnosis, treatment of the mental illness, and trying to study the mood, behavior, cognition of perceptions, and mental status, and all those things, because the mind is important to determine anybody. In fact, when people are calling for interview, for all examination, all that, they study the mind more than anything else. And that, moreover, whenever we give our answer book in the examination hall after answering all the questions, and so the person who is not there when the valuer is valuing, it is a mind that is valued by the examiner, and he will assign the marks. So the marks card is not for a ABCD person, but it is the marks card given for the mental status and preparation, and also the wisdom and understanding, etc. of that. So the mind is such an important thing. And just now we have the Medha Devi Suktam recited by Gajarana Bhatt from India. And we have Saraswati, Sharada, she is called Sharada. Absolutely perfect and clean and clear. And Sharada Anugraha is very much wanted and all that. And so when these corresponding authorities of this mind are very much favorable to us, we are always very, very happy in the world. But if we can't expect our health to be always normal, sometimes deviations come up. And people are also having a lot of myths, she call it not reality. See, myth is not reality, but it's imagination. And also there are many conceptions which are not properly understood. And because of these myths and conceptions, fear takes root in individuals, and that fear is an interesting drain for the happiness or enthusiasm or work. And therefore, it is quite important for us to look at the mental health also, not only the physical health, going to gymnasium and build up muscles and all those things, but we should be also very much taking care of the mind. That's why we make meditation, yoga, and all these things we take up. And today we have got a very busy doctor from Atlanta, and actually I requested her repeatedly, Amma, you should try to come out and share your ideas and thinking, because you have been in the psychiatry for the past 25 and more years, and having completed medical education in India and psychiatry in America, United States, she has practiced and has number of things. And she is connected with the public mental health system, taking care of individuals with persistent mental illness. And also she is also administrator, not only a doctor in that way, but she is also an expert in managing the complex mental psychiatric conditions of various people, because psychiatry comes from the child, adult, and also senior citizen. So the mind problem is not only coming at the age of when people become senior. No, that mind could, because what is man? Philosophically, it is man is equal to God plus mind. So if mind is properly administered and controlled and disciplined, etc., he is God only. Man is God, God is man. So therefore, that mind is important thing, and that is what we have got to. And so today we have got a very interesting speaker, and also we have invited that Sri Devi. She's also another psychiatrist working very busily in the Atlanta hospitals, and she has also got a different specialization. She is also joining to give some remarks or her own things on this beautiful subject, because what misconception and also the myths become cause for the fear in the body, bhayam. So kama, krodha, lobha, moha, mada, matsarya, all these are out of the bhisha. So thereby this fear has got to be removed. So whenever we see a doctor's face, 50% of our fear will go. I'm getting better. And moreover, having a conversation with the doctor, the patient forgets all some of the important symptoms to mention. He thinks that I'm all right, like Prabhakar. So looking at the doctor, not saying. But anyway, the mental doctor knows the condition of the mind. And psychology also comes into picture. So clinical psychology. So psychology, psychiatry, and all this depends upon the psychosis. Not talking much, I don't know about this all, but still our Veda contains a lot of information on this mind. For example, whenever you want to protect yourself in Mahanyasam, there is one section called Atma Raksha Kartavyaha. In that, the Rigveda mantra, first one is Mano Jyotir Jushatam Ajyam Vichinnam. So the mind is a jyoti, is a lamp, is light to shine from all in all directions. So not much talking about the mind status. Almost all singing, even in music also, people indirectly guide people and chide people and all that, addressing Oh Manasa. We have number of kirtanas by Tyagaraja, Muthuswami Dikshitar and all that. So mind is a all-pervasive subject matter, and such today we are having from Dr. Madhu Gundlapalli, who is not very far away from us. She is the co-sister of my daughter, Lalita Gundlapalli. Both are doing a lot of good. She's on engineering side, my daughter, and she's on medical side. So, and fortunately, their mother-in-law and Dr. Varalakshmi Garu, she is also present, and she must be very proud to have such a wonderful daughters-in-laws and sons who are contributing a lot for the welfare of mankind and all that. Thank you very much. So now Dr. Madhu Gundlapalli.
Thank you. Prasad, is sound check? I'm good? And do I have control of my screen?
Yeah, you have, and please continue. Thank you.
Okay. Thank you. Namaste, everybody. Thank you, Dr. Pravachana Garu. You pretty much covered what I wanted to address this group today. So thank you for that very beautiful introduction. Thank you, Dr. Sita Ramalakshmi Garu and Prasad, for this opportunity to share my thoughts to this group. Just as Professor Pravachana Garu shared with you, I am a 30-year member of this community of psychiatrists, and I do really want to say a warm thank you to my patients for allowing me to be part of their journey and for teaching me so much to be part of what they endure. And based on this 30-year experience, I'm sharing with you what I know today. So it is not uncommon to remark, sorry, hold on a minute. Are you not hearing me? Okay.
We can hear you.
We can hear you. Okay, but my screen is not. I'm not sharing my screen. Is that
If you can,
right?
if you can share the screen again, that will be good. So if you go to share screen, and then okay, let me try. Yeah, we can see the slides.
You can see the slides now.
Madhu, can you do it in slideshow mode? Yeah, thanks.
Yes, I got this. Okay. Like Professor indicated, this is my first time with this group, so obviously you can see early beginning difficulties, but let's get going. So it's not really uncommon when one sees something unusual to say, oh, that's so crazy. Or when we are sad to say, I'm so depressed today. Or to exclaim, oh, that person is mental. It's a word that pejoratively categorizes a person as someone to be feared, or to be avoided, or to be mistreated. Some of us have entertained ideas that mental illness is due to non-appeasement of the gods for having committed some sin. Is this right? Let's learn more about that. We communicate happiness with heart emojis, or we say our heart is full. Profound sadness is sometimes represented as being broken-hearted. Have you wondered why we attribute emotions to the heart? It's not uncommon to say, hey, I'm making up my mind, or I changed my mind. When we are sharing our thoughts about decision-making. So have you wondered, where is the mind? What part of the body is the mind located in? If the mind does the thinking, what does the brain do? So I'm hoping through some of our conversations today that we have a better perspective on what the mind is, what the mind-body connection is. The mind is the ability to think, to feel, and act. And our brain is the physical organ in the body that allows us to have this ability, that supports this ability. So just like Professor Prabhakar Garu introduced the topic, we have to do everything we can to protect our brain, to keep it as healthy as possible, and give us that resilience that helps us keep our mental health going. What the mind generates is based on a signal that is being experienced in the moment, but it's not just that. The mind also understands it in the context of previous life experience, whether that experience has been positive or negative. So the brain receives a signal, but the mind then uses the contextual understanding of it through these past experiences to think or act or feel a certain way. We also know that the brain does not function by itself. We cannot separate the brain from the rest of the body. So physical health and mental health is all health. It's all the same, happening to the same person. So what happens in the brain affects the body, and what happens in the body affects the brain. We all have experienced this. So sort of based on the emotions evoked, we may feel a physical sensation in our chest, and that's why we say our heart is full. When we are surprised, the hair on our skin stands up. And so the body is telling us that we are experiencing the emotion of being scared. When we are scared, the heart may beat really fast. It doesn't mean that the heart is telling us that you are scared. The brain is telling us you're scared, but we experience that physical sensation in the heart. When we are happy, the whole body feels good, and it's a sensation that washes over the whole body. So I am just trying to sort of share some very simple ideas that help us understand that the mind and the body are connected. This is the mind-body connection. So what is mental health? Mental health refers to our emotional, psychological, and social well-being. Mental illness refers to those conditions that affect a person's ability to think, feel, mood, or contributes to their behavior. So conditions such as schizophrenia, depression, bipolar disorder, anxiety disorders, that's mental illness. So the everyday person's perception of mental illness is shaped by the movies and stories in the media. Movies portray the affected individual as violent, provoking disgust, or to be shunned by the people around them. The individual's behavior is perceived as fear-generating or something shameful. Have you wondered what these characterizations do and how they stigmatize and marginalize a whole group of people among us who may be experiencing mental illness? Where am I going with all this? I want to share with you what psychiatry is, field of medicine focused on the diagnosis and treatment of mental illness, treatment of mental, emotional, behavioral disorders, and the myths and misconceptions that exist today or have existed in about mental illness have contributed to stigma and leads people to be ashamed and not seek help. And by sharing some of these thoughts today, I hope to open a window into this world of psychiatry by addressing some of the myths. Myth number one, psychiatrists are not real doctors. In medical school, as we were making our choice about what we wanted to be when we grew up, what kind of a physician I wanted to be, my choice of psychiatry was questioned as to why I was not choosing a real field of medicine. Well, I became a psychiatrist because I was inspired by my psychiatry professor whose actions and the way he taught us about what mental health was inspired me to be a whole physician. Let me tell you why I think that. Mental health disorders contribute to distress and interference in functioning, and the psychiatrist has to understand that individual who's experiencing this distress and interference in their functioning in the context of their life experiences, explore their behavior in the context of the presentation, when the problem started, what other factors may be involved, what were the triggers, what are the risks, what medical issues the individual has, what medications are they on. So you have to understand the psychiatrist has the person sitting in front of them in the context of all of this information. They have to review lab work, they have to look at the EKG, any X-rays, brain imaging studies like a CT scan. They have to look at all of this information to arrive at an accurate diagnosis. And then once an accurate diagnosis is made, they have to come up with the right treatment plan. The treatment plan includes medication, talk therapy, lifestyle changes, relationship changes, all of which go together to contribute to improvement in functioning. When it comes to medication prescribing, there's an art and the psychiatrist has to choose the medication in the context of the problem, understand the medication itself, how it works in the body, what kind of side effects the individual may have. And side effects may not all be bad because the psychiatrist may actually harness the side effects to treat a particular symptom the individual may have. The psychiatrist has to understand, can the individual tolerate this medication? What are the medical conditions could this medication interfere with or contribute in a positive way? What dose shall I choose for the patient? When shall I prescribe the medication? How quickly do I adjust the dose? What other drug interactions might be occurring? So the psychiatrist has to take into account a lot of all of these factors to be a good prescriber. I want to share an example of one particular medication, say lithium. Lithium is a salt that is used to treat bipolar disorder. Bipolar disorder is also, was previously known as manic depressive illness. So this is a mood disorder where people experience very high highs and very low lows. So the high is called mania, the low is called depression. Lithium may also be used in depression alone without the mania when normal treatment for depression is not working very effectively. But the dosing for bipolar disorder is very different than the dosing for depression. If the patient has kidney disease or has thyroid disease, lithium has to be used very carefully. If my patient works in the hot sun and is at risk for dehydration, the lithium dose has to be monitored carefully because he may become toxic because of dehydration. Or if my patient is extremely physically active and can be injured in some activity and takes Motrin or ibuprofen, which is to help with body ache, the lithium dose may go very high, can become toxic. And when the lithium dose is high, it affects the heart. Is my patient elderly? Do they already have issues with fine motor skill issues? Because lithium has tremors. And so if I prescribe lithium to someone who's elderly, I need to be aware that even simple tasks like buttoning up their shirt could become difficult. So in my effort to help them with their mood disorder, if I've contributed to an impairment in functioning, that's not very good. Is my patient a young woman who is thinking of becoming pregnant? In pregnancy, lithium has serious side effects for the fetus. So I'm just using the example of lithium to share with you that psychiatrists are a complete physician because they have to know not just about the mental illness part of diagnosing, treating, and managing that part, but to recognize that a prescription of lithium can impact both the mental health part of the issue in a positive way, but could have significant for the physical health as well. So I disagree with this myth number one. Psychiatrists truly are real doctors. Myth number two, mental illness is not real illness. So as has been stated previously, mental illness is characterized by disturbance in thinking, emotional regulation, behavioral issues, and it's caused by a combination of factors. You may have a genetic predisposition, meaning hereditarily passed on. It could be in your genes. It could be caused by chemical imbalance. It could be caused by adverse life experience or a negative influence on the brain, such as a brain injury or drug use, substance use, excess amounts of alcohol or other street drugs. So advances in neuroscience has shown us through brain imaging studies that there's evidence that mental illness has impact on brain structures. It is important to underscore that it's a very, very complex issue, as brain disorders have to be understood in the context of social, environmental, and psychological impairments. And again, mental illness is not a homogeneous experience. Each person experiencing the illness has a varying intensity, their own episodic frequency. No two individuals with the same diagnosis experience the same symptoms or the same trajectory of illness. Again, response is unique to the person. The journey is unique to each individual experiencing that journey. And generally speaking, most mental illnesses are chronic conditions. Diagnoses that cause people to seek attention for mental health. It's largely, I like to think of them in three large buckets. Psychotic disorders, which are disorders of thought, which results in the individual losing touch with reality. Schizophrenia is the most impairing psychotic disorder. And even here, mislabeling schizophrenia as split personality, which is pretty common understanding of schizophrenia, is very untrue and is an example of misunderstanding and misconceptions about mental illness. It really does huge disservice to a person experiencing schizophrenia. Another large group of disorders are mood disorders. As I've said before, depression, which is profound sadness and associated with other symptoms as well, affecting the whole body, the whole person, and bipolar disorder, which is periods of extreme high mood and extreme low mood as well. The third bucket are anxiety disorders, such as panic disorder, generalized anxiety disorder. Previously, obsessive compulsive disorder used to be part of this categorization. And anxiety is experienced in many different forms in this disorder. Medical conditions may also present with psychiatric symptoms. Diabetes, 1 in 3 individuals in India experience diabetes. It's a very common metabolic endocrine disorder. Uncontrolled diabetes can be associated with depression. And on the flip side, a depressed individual with diabetes will have a very hard time getting their blood sugars related. The blood sugars being high can contribute to insomnia, which is not being able to sleep very well at night. And then the insomnia actually increases the abnormalities in the blood sugar. So again, that mind-body connection. Depression may be the presenting symptom before another medical condition shows up later. This is very common with pancreatic cancer, for example. The depression may precede the diagnosis of pancreatic cancer by a year or two. It can precede the diagnosis of Parkinson's disease by up to 5 years. And the point I'm making here is that these are neurobiological conditions. The depression is not because of the diagnosis, which can happen when you are experiencing a serious diagnosis like cancer. You could respond by becoming depressed, but it is important to recognize that this is the mind-body connection. They affect the person, their sense of self-esteem, how they interact with the world. And as I've shared all of these, I hope you are drawing the conclusion that mental illness is a very real illness. Children do not get mental illness. Myth number 3. ADHD is a chronic, is a childhood onset disorder, can become chronic, but there is the ability to treat it effectively. However, untreated, it can be extremely impairing and disruptive to a child's life. This may also result, when not diagnosed accurately, to mislabel the child as lazy or irresponsible or as a troublemaker. Anxiety and mood disorders are not uncommon in childhood. The severe illnesses such as bipolar and schizophrenia is somewhat rare, but they do occur in children. Therefore, we have concluded, and you, I hope, understand that children are not immune from severe illnesses that can be extremely disruptive to their lives. Myth number 4, bad parenting causes mental illness. Some early theories about schizophrenia blame the mother with the idea of the schizophrenogenic mother. We've heard of the phrase nature versus nurture. Parents are, of course, very influential in creating the environment that shapes the child's early life experiences, the building blocks for a sense of self, laying the foundation for how to cope with adversity. When there is a breakdown in this nurturance, or if during the growing period, if you're exposed to neglect, poor nutrition, or invalidation, when there's exposure to childhood trauma in the form of physical, verbal, or sexual abuse, it sets up the child to experience mental illness. But it's not that the bad parenting automatically contributes to mental illness. It is about an indirect impact. So I share this to say, in order to protect the child's brain, it is important that that nurturance be healthy. not every person and not every child who experiences trauma experiences PTSD. It's because of the resilience and the coping that that the parent may provide through their nurturance that mitigates the negative influence of the trauma. So it's not bad parenting that causes mental illness, but good parenting can be a protective factor. Myth number 5, people with mental illness are lazy, unintelligent, or incompetent. The pathways in the brain in certain illnesses include circuits that are responsible for attention or for motivation, for problem solving, or all of the above. When there are certain mental health conditions impacting these particular brain circuits, the individual experiencing that illness may present with apathy, which is an inability to interact appropriately with their environment, or they may not be able to respond appropriately to a sensory signal that is coming from the environment. Depression is associated with low energy levels and difficulty concentrating or being easily distractible. Sleep impairment, which is a very common symptom across many mental illnesses, contributes to difficulties with attention, with concentration, or the ability to focus on important details. In a psychotic disorder, this is where the individual loses touch with reality. They may experience a symptom called auditory hallucinations, which is voices in their head that is having these pretty animated conversations with them. And this can disrupt the person's ability to pay attention to what's happening around them in a manner that may come across as disinterest or incompetence or not being intelligent. However, it is important to recognize people with mental illness are not lazy or incompetent. It's a particular impact of the illness on certain brain circuits that may be contributing to their presentation. Myth number 6, talking about suicide will make it happen. It is often very difficult to find the right words to support or reassure someone who's experiencing mental health issues. The behavior may be abnormal or difficult to understand. It could be very challenging for family and friends to figure out how to talk to somebody with these kinds of conditions. And so they may choose avoidance instead of being present. The conversation may be shaped by fear of offending or fear of saying something that is they think may be wrong. They may think that by, for example, talking about suicide, they will plant the idea of suicide in the individual. I want to share with you that this is not right. It's not true. Talking to a person who's experiencing suicide may actually prevent them from going through with that action because you may be throwing the lifeline for that person. Suicide often is a cry for help. It is because the individual is so overwhelmed and so distraught, they think there is no hope for them. And so by your mere presence, your willingness to talk to them, to have them share their thoughts may help you support them in shaping the right kind of decisions, to ask them to get professional help. So talking about suicide is in fact beneficial to the individual experiencing that. Myth number 7, mental health challenges are a sign of weakness. For a long time, substance use, addiction has been misunderstood as stemming from a lack of willpower or lack of self-control. We now have, through advances in neuroscience, strong evidence that addiction is a chronic but treatable medical condition. The brain circuitry involved in reward, stress, and control are affected during addiction, and brain imaging, that is MRIs of the brain, have shown distinct changes that explains the compulsive nature of addiction. There are, of course, genetic, social, and environmental factors that play in the role of a development of an addiction, but there should be no doubt that addiction is a brain disorder. Mental health disorders and addiction go hand in hand sometimes. We call this comorbidity in our field. And substance misuse may cause psychiatric symptoms like during an intoxication stage or withdrawal stage from a substance addiction. The person may present with behavioral issues that can imitate a serious mental health condition. So substance use and mental health disorders going hand in hand, that's a double whammy. Those struggling with addiction face a tough challenge because it takes a lot of hard work, a lot of strength to actually participate in their recovery, to attain sobriety. Mental health challenges are definitely not a sign of weakness. Severe illnesses such as schizophrenia, bipolar disorder, and depression, they increase the risk for suicide. When suicidal thinking is paired with hopelessness and an access to lethal means, suicide occurs. People with suicidal thinking may sometimes entertain these thoughts daily. They don't act on it daily, but they may entertain the thoughts of suicide daily. It takes effort and courage to get through the day while you're having these thoughts of suicide. Just as an example, many of us participating in this conversation today have experienced anxiety. We may be waiting for a news or some result. It doesn't have to always be something negative, even positive news, anticipation of that. It takes a lot of effort for us to focus on everyday things when we are waiting for that result. We all remember that. I mean, we're constantly distracted. We start something and never finish it because suddenly our mind is focused on the anticipated news. So just that little piece gives you an idea. If you now magnify that many, many times, especially when the thoughts are about desperation or painful memories, you can imagine how disruptive that can be, how much it can interfere with functioning. And so for that person, for that human being who's experiencing symptoms of mental illness, for them to get through everyday life while they're experiencing that symptoms takes a lot of courage, a lot of strength. Mental illness is definitely not a sign of weakness. Myth number 8, people with mental illness are violent. Most people with mental illness are not violent. Sometimes, the movies portray people with mental illness as violent, and we make this very wrong connection that the mere diagnosis of a mental illness automatically makes that individual violent. Clinically, we call this aggression. Aggression is what violent acts are. The risk of aggression is, of course, elevated in mental illness because the circuitry for aggression is also involved in the brain circuitry with mental illnesses. But the diagnosis itself does not automatically make the person violent. The baseline risk of aggression, when it's complicated by substance use, alcohol use, which might take away your inhibition or make you more impulsive, or if you are experiencing like your back's to the wall, you have untreated mental illness, the world is not making sense to you, you're feeling desperate. During those times, maybe the individual with mental illness may react to that circumstance with violence. So again, people with mental illness automatically are not violent people. Untreated mental illness or co-occurring substance use or the sense of helplessness that may be part of the illness or the life circumstance, these do increase the risk for violence. Sometimes as part of the illness, such as in schizophrenia, when you're hearing voices that are commanding you to act a certain way, and these voices are so persistent and so intrusive that the person cannot ignore them, maybe in response to those command hallucinations, the risk of violence increases. But again, just the diagnosis alone automatically does not make people violent. And as we've talked about, mental illness is not one single entity. There are very many different types of experience of mental illness, and we need to disengage from this idea that people with mental illness are violent. Myth number 9, there is no hope or recovery for someone with mental illness. The field of medicine has really evolved a lot in terms of our understanding of mental illness, the brain circuitry involved, the interplay of various causative factors. Treatments are available. There is hope and recovery every day. Medication, talk therapies, lifestyle modification, protection of the brain from additional insults by staying away from toxic substances like illegal drug use are all effective strategies to manage mental health. Medication treatment has expanded in the number of options available. We have antidepressants, anti-anxiety medications, medications to treat psychosis, mood stabilizers for bipolar disorder, medications to address sleep disturbance, and so many choices. Antipsychotics, the newer generation of medications, actually serve as broad spectrum treatment for very many conditions. We also have medications that are available in injection form that allow treatment as in once a month dosing, once in 3 months dosing of the antipsychotic to help someone who's dealing with this, with a psychotic illness such as schizophrenia. We also have so many options for detoxification and maintenance treatment for people with addiction. There are effective talk therapies with very defined application. When I say talk therapies, I'm sure it evokes visuals promoted by cartoons of the psychoanalyst couch. We have, now way more opportunities than just the Freudian way of psychoanalysis. We have brief psychotherapies, that is a 6 to 8 week session targeting a particular symptom, cognitive behavioral therapy, dialectical behavioral therapy, family therapy, mindfulness therapy, motivational interviewing, stages of change, specialized talk therapies that address special symptom clusters. We have neurostimulation therapies like electroshock therapy, transcranial magnetic stimulation, biofeedback. Of course, I'm in rapid speed shared with you, we have a wide variety of treatment options to promote hope and recovery for individuals with mental illness. I just want to say, I hopefully have opened the window to the understanding that there is hope and recovery possible for everyone with mental illness. Earlier, I asked, where am I going with all this? I said I wanted to open a window into the world of psychiatry by dispelling some myths and misconceptions. Interwoven through this conversation today, I hope I laid a basic framework to improve our understanding of mental illness by sharing the biological nature of the illness and breaking down some of the myths and misconceptions associated with this field so that we can all be present and support family, friends, and individuals who experience mental illness to fight every day to be successful and to maximize the potential each one of us have. Thank you.
Thank you, Dr. Madhu Gundlapalli. It's a wonderful talk where you really helped all of us understand the mind-body connection. And you really gave us a wonderful overview of the profession of psychiatry and a window into the profession, as you said, and the world of psychiatry. So it's wonderful. A lot of things we learned. And I like how you organized the talk around things, we all really, consider as myths, right? And the stigma issues and how we could be more inclusive when we are around people, who are our friends, colleagues, family who go through these challenges of mental health, mental illness. And I think I definitely learned a lot about, things that we need to know to understand people with these challenges, even ourselves when we're going through these things, how to deal with it, and in some cases even seek relevant treatment. So yeah, it's a wonderful talk. Thank you very, very much for sharing your knowledge with us. And I'd like to ask Dr. Sridevi Vayalapalli to please provide some remarks on the talk.
Yeah, before 1 minute. Before that, I have to go one question. What is madness and what is craziness and how it is connected to the mind? And secondly, my professor who used to say everybody is 50% mad. And if the 50% madness rises up, then there's a problem. If it goes to beyond 75, 80, it should be in Bedlam or the hospital where this all mad people are gathered. I don't know. And on the contrast, I was also told about equipoised mind in yoga. See, I want to know something about craziness or equipoised mindedness or madness. And madness below 50% a problem. Above 50% is a problem. So we have to maintain that kind of madness. And so have you anything to say about it from medically or mentally?
I think madness, craziness, all of the points you've raised, it's just us trying to understand something that we may not have a clear understanding of. I know not of a symptom called madness or craziness. It's a colloquial way of sort of trying to understand the abnormal behavior or abnormal thinking some people may experience. Yoga and equipoise, I forget the word you used, but I think yoga serves as a way to center somebody, to be able to corral maybe thoughts that are going in multiple different directions, not kind of to present and just being poised and centered within yourself, to show that calm, the composition of your mind, and to respond with the right kind of balance to any kind of emotional signal that is coming. So you may be experiencing multiple thoughts, but maybe yoga gives you the strength to focus on one particular aspect that the situation or the context calls for, and to present that side of yourself. So again, I think it's easy for us to sort of understand certain physical conditions like a broken arm, for example. People can, even if they don't have a broken arm, they can put themselves in the shoes of a person with a broken arm and say, oh, it must hurt. Oh, we may not be able to do this, that, or the other. Whereas if it's a broken mind, it's really hard, if you've not experienced that, to put ourselves in the shoes of a person experiencing that broken mind. I'm just using very, broad terms here to understand it. And so when we don't understand it, we may say things like craziness or madness as a way to explain something we don't understand, something we know very little about. Maybe, I hope. But there is no symptom called craziness or madness in any of the symptom profiles associated with the diagnosis.
But otherwise, generally people say, I'm mad, don't talk to me. Like that, they shout and get out, make people get out, or they get out. So that's one thing. And another question is, hey, today I'm very mad. I don't know the circumstance, but I may not talk sense. So I may talk sometimes senseless thoughts. So pardon me and bear with me. That's how people, sometimes professors begin their talk. I remember my professor, today I'm mad. I don't know whether I talk sense, but whatever they talk would be sense. But still, the mad word, which is used very often connected to the mind status. And that's why it is we got to make the fire of the mind is also a fire. And it's a flame, and so it had to be kept. And so crazy. These are all commonly, because you said misconceptions about the madness is a misconception actually, because people behave in a normal way. But if there is a deviation from normalcy and some emotional excitement and all that, so all that refers to mind, not only the heart, is it not?
True. And the word being mad is a state the state of mind, right? An emotional state in the moment may be result of certain things that are happening in that person's life or something that happened that day. The mad is an emotional state, but mental illness is, it goes beyond that, just that moment or a day. It is something that persists in that person's situation. So yeah, that's the, I think that's the difference. There was a question in the chat about preventive measures for age-related conditions like dementia. Yes, keeping a healthy brain is the first and foremost important. So what does that mean? Making sure that your physical health parameters are, good. Protect yourself from diabetes, manage your blood sugar, make sure your blood pressure is in normal range. Weight reduction, if weight is non-issue, so these weight is an issue. So these are a healthy physical state will help you have a healthy brain as well. Also, challenging the brain to engaging in activities that stimulate more neuronal activity, laying down new neural networks. That's another good, effective way of protecting your brain. Engaging in healthy exercise, which releases good, endorphins and keeps the chemical sort of context in their brain healthy. That's another way to engage in preventive measures for dementia.
So now another Dr. Srividya, she is also there here, Sridevi. And she will be, actually she has been a sincere student, having number of doubts when she was trying to learn or know about the Saundarya Lahari of Sankaracharya, who Sankara is a high intelligentsia. So today she will be coming out with her medical knowledge and also. So now Dr. Sridevi.
Hari Om Andi. So nice to see you this morning, Prabhakar Garu. Sri Gurubhyo Namaha. Thank you, Madhu, for an elaborate presentation on the field of psychiatry. It was very informative and you pretty much covered everything. I don't really need to add much. And also we want to sincerely welcome Madhu to Atlanta. Madhu and the family. Hopefully we can meet sometime soon. So I just wanted to make a few points because Madhu has already covered most of the psychiatry misconceptions. First thing I wanted to elaborate is about crazy and being mental, especially people in psychiatry, we don't understand somebody, we call them mental or crazy. But in my private practice, majority of the patients that I see are high functioning professionals who are physicians, who are students, who are engineering students or nursing students, or in fact, I see a lot of PA students, multiple professional, kids and also adults who just need some additional support during their difficult times. I really don't see a lot of chronic mental illnesses like Dr. Gundlapalli sees because of you're working for the state. But I have a complete different practice because I see a lot of higher functioning people. They just need some support during their difficult times. Definitely, I don't have a couch in my office and we don't read anybody's minds because a lot of people think that, oh, psychiatrists read minds. We never read any minds. The only thing that we do is we get a good thorough history, and based on the past experiences and their nurturing and their genetics, we try to predict their future. That's what we do. We never read anybody's minds. I think that's a big misconception. Anywhere I go to a party or I don't want to talk to you because you're reading our minds. Okay. The other thing that I want to stress is that mental illness is very synonymous with other medical problems like asthma, diabetes, or hypertension, because there are a lot of brain changes that happen when people have mental illness, say for depression or anxiety or psychotic disorders that Dr. Madhu Gundlapalli has explained, schizophrenia and all of those, because schizophrenia is only 1% of the population, very, very less. Versus depression, you see a lot more population. The prevalence is much, much higher, like 25 to even 30% of the population goes through depression or anxiety. And coming to the question that Dr. Prabhakar Garu asked about, madness and getting treatment, one thing I see that in psychiatry is we all go through some depression. We all go through some anxiety in our life, but things have to be treated only if they are causing some issues with their quality of functioning. Suppose a patient is not able to have a good relation with their spouse, they're constantly fighting. They are not able to perform at work. They are not able to have a relationship. If they're having a major issue in the life, even if they have some depression or anxiety, we treat them. Suppose a patient goes through some anxiety, simple anxiety, but it is not affecting their quality of life, then we don't treat them with medication. We generally refer them to a counselor, or brief therapy that Madhu has talked earlier about CBT or any brief therapy for 6 to 8 weeks or so and so forth. So the important point that I want to make here is that mental illness is a brain disease comparable with other medical illnesses. And we can see a lot of changes in the brain with the people with depression or anxiety or schizophrenia prior to treatment versus after the treatment. They were able to see a lot of changes. And these are all well documented in a lot of research papers also. The other thing I want to focus is it is a multifactorial in nature. Generally, when we take a history, we go through what is called as biopsychosocial formulation, and we diagnose the patients based on the genetic factors, the comorbidity of other medical problems, trauma, as you have already explained, Madhu, about sexual, physical, emotional trauma, abuse, and important thing is resilience in life. That is a very, very important factor that I've noticed, especially when we were treating patients during the COVID. Lot of us went through depression and anxiety during the pandemic, but only people that I was able to treat or sought help were people who are lacking resilience in their life, didn't know how to bounce back from difficult situations, either because of lack of support, lack of confidence, lack of faith. And especially, I think one of the important factor, I think somebody asked in the chat, what helps in preventing dementia? I think one thing that really helps in dementia is learning new things. And one of the things that I really liked was attending Dr. Prabhakar Garu's lectures, because that is very stimulating, and learning new things also helps the brain to form new neurons. That is a new theory that came up only a couple of decades ago, that the brain also can regenerate even in the senior citizens also. So the more you chant, the more you stimulate your brain, the more things you learn. So for example, I tell my patients, go for dance lessons for elderly patients, go for walking, or do something exciting, crochet, do some Sudoku, puzzles. So just stimulate your brain also helps you prevent dementia. So one of the free things that we have is Prabhakar Garu's lectures. I think they are really superb in helping us prevent dementia. That's what I think every time I attend your classes. So the other thing is emotional pain is worse than the physical pain, because physical pain, as Madhu has pointed out, if you have a broken arm, you can relate. People can tangible, they can see it, or it's more tangible, but the emotional pain, we cannot relate. And it is very, very hard. And especially in the Indian families, in Indian community, it's a big taboo. Going to a psychiatrist is a big no. They really burn their bridges before they come and see a psychiatrist. I'm yet to see a Indian patient who says, I found your name from my friend or family. Versus I have a lot of white families, a lot of black families who say, hey doc, my daughter sees you, or my neighbor sees you, I got your number from my neighbor, or my friend sees you, that's how I got my number. I have yet to see an Indian family who say, I got your number from my family or friends. Actually see husband and wife, and they don't know that they're seeing me, but I know that they're both seeing me because of confidential reasons. I don't talk to them or tell them. That's how it is in Indian families. We don't talk openly about mental illness. I think that's a big taboo. I want to see a day when we all openly speak in our parties. Hey, I have diabetes, I have hypertension, I cannot eat sugar, I cannot eat salt. I want people to talk about, hey, I have depression, I need help. Whom do I go to? I think that's a big thing I'm yet to see in our community. And the other thing that I want to stress is asking for help is a courage, not a weakness. I think we have great capability, especially in Indian communities, to keep it under the rug. We don't bring it out. We don't seek help at the right time. I think turning to our community resources and also to higher power, spirituality is very, very important. I actually ask my patients to read Bible, to read Quran, depending on their religion, because higher spiritual power always helps in preventing mental illness or to get through the tough time. I want to share my own experience as a mother. I went through postpartum depression after my second child, and it was not easy. Come to a different country, you are an immigrant, you are working, your husband is working, we didn't have help, and it's very hard. I didn't know whom to ask for. And at that time, I was going through Bhagavad Gita slokam, Adhyayana yoga. That is, I want to chant that slokam, Uddare Datmanatmanam, Atmanam avasadayet, Atmaiva hyatmano bandhuhu, Atmaiva ripuratmanaha. It means that one has to push oneself up. You are your best friend and your worst enemy. Lot of the patients that I see in my practice, they jeopardize all the good things that are happening in their life because we become our worst enemy in our life. And the reason I brought this slokam up is that was what helped me go through the depression I went through for a brief time in my own life. So the important thing that one can help is by asking for help, because asking for help is a great courage. The important thing about mental illness is improving the quality of life. First thing when a patient comes to my office, they ask is, do we have to be on medications? That's one. And how long I should be on the medications? So I tell them it's not about the duration of time, it's about their quality of life. Not everybody who comes to a psychiatrist are prescribed medications. About 10-12% of the patients, we tell them, hey, you're doing good, because parents, they bring their children saying that, oh, my child is not performing well at school. He's very anxious. We want to medicate them. We have to tell them, hey, this is a normal child. This is a teenage child who is going through hormonal changes, and you have to be patient with your child. They don't need to be treated. So 20% of the patients, we don't start them on any medications. We just counsel them or refer to a counseling or therapy. So the important thing is not everybody who goes to a psychiatrist are bombarded with medications. I tell them, you use all the resources, all the coping skills, all the tools in your life to make your life a better quality of life. That's what I focus for my patients. And some of them, we use medications. You get it by going to church, you go and ask for help, getting more support, delegating work. We are no way superwomen or supermen. Sometimes you have to say no in your life and ask for help. I think Indian community, that's what I would request everybody. If you need help, please ask for help, whatever it is. That is the best help one can do for oneself. And thank you.
Very good. And I think Neeraj, Dr. Neeraj, who is a neurologist, has some question in the chat box. Or did you notice? Dr. Neeraj?
Yeah.
Yes, Prabhakar sir, how are you? Good morning and Gurubhya Nama to all of you. So, I just had written one question about how do we think in the previous time, like before the advent of all these medications, this psychiatric illness were known. And, we know that there's a mention of this bhoot agya, or like there's a ghost, those things, or depression, even though like they were all under recognized. And now because we are able to screen them and we are able to pick them a little bit early, still I would say a lot of patients are still underdiagnosed and under recognized in the community as well as wherever we go. But the treatment wise, even though the medications are one of the things, counseling is the other thing. Like what was the advent, like let's say 500 years ago, 1,000 years ago, before this? So just want to know what are the origins and what is mentioned in the Ayurveda. If any of us have an idea, that would be really useful to know.
I cannot answer that question, Dr. Neeraj Garu. I really don't know about Ayurveda.
Yeah.
Sorry.
Yes, I'm sorry. Any thoughts among the group? If not, like I think maybe we'll have to find it out. The reason is there are limitations of our scientific advancements. Like we see that yes, we are advancing in the right manner, but sometimes I feel like we are advancing in one way, but we are also going back in the other way because the medications we are causing the side effects. We are able to control the symptoms, but at the cost of the quality of life to some extent, because we are just keeping the patient sedated, just trying to control their emotions. So that is my thought. So just, yes.
I think we have to, when we start a patient, we have to weigh the risk benefits of taking the medication versus not taking the medication. Sometimes, for example, I treat a lot of patients in the nursing homes. Okay, patients get very agitated. So sometimes I'm treating the patient. It's not that I'm treating the patient, I'm treating the staff at that point. Otherwise, they're kicked out of the nursing home. They don't have a place to stay. Family has actually abandoned the whole, the patient. They don't have any friends. So sometimes we have to treat the staff, otherwise they become homeless. So it's a kind of tricky. I don't know what you think, Madhu, but that's my experience. Because we...
Yeah, and sorry to interrupt, and treatment is not sedation. That's actually not the goal of treatment. And as a prescriber, if all I'm doing is sedation, then I've failed the patient considerably. So clearly, we have to acknowledge that we take the medication is taken orally, and yet it has to be distributed ubiquitously in the brain, and different. There are so many functional associations in the brain where it's impossible for us to deliver that antipsychotic to that one particular circuit in the brain, because it's right next to something else that might be impacted. So that's what the side effect is, and the efficient, effective psychiatrist understands the profile of the medication and tries to match. So if your patient with their illness also has a problem of not sleeping, for that person, a medication that has sedative properties will actually harness the side effect of the medication to help the individual. We agree with you. Our psychiatric medications do have a whole host of side effects that have to be considered, but the goal of treatment, though, is not individual. The goal is to try and decrease the distress associated with the symptoms and improve the functioning of the individual, like Dr. Gundlapalli has shared.
Yeah, I do agree with you because even though as Dr. Pravachana mentioned, yes, I am a neurologist. I work at Madhu, work in the ICU. So we do give patients the medications that has to be done. But in general, because I do not see a lot of patients as an outpatient, and what is like we have to control it, and we are not as like a physicians. I just feel basically that we just don't think that I am trying to treat the root cause. So the root cause is something which ignited the problem, and like that's a much bigger problem than what we usually see. Like how this originated, how the disease originated, and is it really a disease or it's just a circumstance that is causing the problem? So I believe like it is a much bigger problem than all these myths. But yes, these myths and beliefs are like you can say that I think they are pouring the fuel to the fire. That's how I do believe. And it was really good to know your insights too, with both of you are psychiatrists. That was really awesome.
And I want to just say, I don't know whether I want to connect the Kalidasa's statement for your question, Ayurveda, whatever it is. So Kalidasa in Raghuvamsam gives the plan, life plan. Yavvane, Kaumare Abhyasta Vidyanam, Yavvane Vishayeshinam, Vardhake Munivrittinam, Yogenante Tanutyajam. So the 4 stages of life. So up to 25 years or so, you keep on educating, culturing, and improving the brain and intelligence and all that, become little well armed. And when once you cross the 25 and all that, Vishayeshinam. Vishayas are Indriyas, Indriyarthas, and also trying to study the life and world and experience and go through the changes, all that during the family, say up to 50 years or so. And again from 50 to 75, Munivrittina, when once you become a senior citizen, senior citizenship starts, then live like a Muni, live like a saint, live like a Rishi, live like that. And ultimately, all through, that means to say that, Yogena ante tanutyajam, when he says that through yoga, I will send my life away from my body rather than the life going away from my body. So through yoga, you can discipline the prana to get out voluntarily. That means to say that I think education, then enjoyment of things connected to our body, limbs, and other things and circumstances and all that, and also becoming more and more disciplined and deserving and controlling because Maunat Muni Uchate, a Muni is a Maunam. Maunam means silent. You lose all your attractions, emotions, anxieties, and take the life smooth and continuous. And ultimately, all this will be a preparation for the yoga. So that, and ultimately, when you get into the portals of yoga, it is easy for us to get away from the body, which cannot be held on for long, long years. So I think Kalidasa might be an answer for your question, sir. I think 500 years or 5,000 years, all the same, but it is like that. So education, experiencing the pleasures and pains of life, and then trying to be silent about many of that, then ultimately that is what is the yoga preparation. Ultimately we get out of it. So this is how the mental mind balance can be kept up, and that will be a wonderful thing.
Thank you, Prabha.
I don't know whether you are connected to your question with this, because there is a preparation all through the time, 100 years divided. And in between, if you abuse, misuse, overuse the limbs that and also the given by the Paramatma, then we will be only subjecting to ourselves changes. Otherwise, if there's a rhyme and rhythm in our body, that balance in our body, etc., is taken care appropriately with the guru advice, with the parental, with the parents' advice and all that, definitely, normally people don't get exposed to mental problems. Physical problems, we can't help it because of the changes in the weather and all these things. But basically, the mind is strong. Mind is said to be, body is not Jyoti. Mind is Jyoti. So the Jyoti cannot be afflicted at all. Surya is a Jyoti, Agni is a Jyoti. So looking from that angle, I think the mind status remains same and would be balanced. That's why there's an equipoised mind. And I mean, age is not the factor for that. For example, Shankaracharya lived only for 32 years, turned out him voluminous work. Whereas Ramanujacharya lived for 125 years. That work you can, and Madhvacharya lived for only 75 years. But whatever be the age, but the work turned out is important, indicates the significations of the intelligence and mind status and improvement done by that.
100% agree, Prabhakar sir. No doubt, like that's why, like all these olden scriptures that we have, it's not olden, basically it's still the same thing and we face the same, but it is so much important to know it.
Yeah. And so,
and I feel like, maybe even the way our Indian culture is in, looking maybe a positive spin on what Dr. Sridevi was saying, why the Indian community does not seek more mental health. Maybe we have had a cultural and religious and social setup that has worked better. You don't experience it much, but now we're all distributed in mixed cultures and in different situations, socially and religiously. So maybe our Indian community now needs more help, but maybe there is something like Neeraj, you're saying, there have been the social fabric or a cultural religious setup in India that maybe the solutions were easily found. And I don't know, I'm just making, I'm trying to put a positive spin on it, but there is probably a good reason why we are as a community not very, even though we have the greatest doctors, why we are not as a community seeking help or more understanding of the mental health challenges. I don't know, but yeah, it's a good question. I think looking back into where we come from. So.
And we have Dr. Gopi Chand, an internist, a senior doctor who has worked in the army, who has been and also he has, at a later stage, he has turned to our Vedic studies also, or Kendra student land. So he will be coming out with his ideas to and also thank all people. Dr. Gopi Chand. Is the Gopi Chand? Yeah, he is there. Dr. Gopi Chand.
Sir, good morning, good evening.
Yeah, your internist is staying in India only, looking at the patients, all sorts of patients in Victoria Hospital, elsewhere. And you are a medical student, MD, an internist also, so you will have some solutions for the thing. And
okay, sir. Yeah. Okay, sir. Thank you, sir.
I'll just conclude with the thanks. So we had a very wonderful Veda Kusumanjali and invocation songs by Uma and Shraddha, and Uday Ravi gave our chanting, and we really thank again Dr. Madhu Gundlapalli for a wonderful talk. We learned a lot, and we invite her to come again and share more of her knowledge and wisdom and expertise. And the same goes to Dr. Sridevi Vayalapalli. So thank you, madam, also for really adding to the talk and giving us more insights. We really appreciate all of it. And so thank you all for joining, and let's say the Shanti Mantram to conclude. Om Bhadram Karnebhiः Shrunuyama Devaः Bhadram Pashyemakshabhiryajatraः Sthirairangai Stushtuvaagum Sastanubhiः Vyasema Devahitam Yadayuः Swasti na Indro Ruddhashravah Swasti na Bhusha Vishwavedah Swasti nastarkshyo Arishthanemihi Swasti no Bruhaspatir Dadhatu. Om Shanti Shanti Shanti. Om Sahana Vavatu Sahana Bhunaktu Saha Viryam Karavavahai तेजस्विनावधीतमस्तु मा विद्विषावहै। ॐ शान्ति शान्ति शान्तिः। हरिः ॐ श्रीकृष्णार्पणमस्तु।